There is a deficiency so common that researchers estimate up to 40% of adults in Western countries have suboptimal levels, and most of them have no idea. It doesn't show up on your standard blood panel unless your doctor specifically orders the test. It damages your nervous system, your brain, and your blood quietly for years before symptoms become unmistakable. That deficiency is vitamin B12. And the warning signs were there the whole time. A study published in the New England Journal of Medicine estimated that up to 40% of the US population has borderline low B12 levels low enough to cause neurological symptoms. The tragedy is timing. Neurological damage from B12 deficiency can become irreversible if it goes uncorrected for years. Fatigue, brain fog, tingling in the hands and feet. People dismiss these as stress or aging. Often, it is B12. And it is correctable. This video draws on research published in the New England Journal of Medicine, Annals of Internal Medicine, and the European Journal of Clinical Nutrition. These studies cover B12 deficiency prevalence, its neurological effects, and the populations most at risk. A 2017 review in Annals of Internal Medicine specifically documented the progression from early to advanced neurological damage in untreated deficiency. The first widespread myth about B12 deficiency is that it only affects vegans and vegetarians. It's true that people who avoid animal products are at higher risk. Studies show up to 52% of vegans are deficient. But research makes clear that deficiency is equally common in older adults due to reduced stomach acid, in people taking metformin for diabetes, in those on long-term antacids, and in people with undiagnosed pernicious anemia. B12 deficiency is dangerous because the damage it causes is cumulative and sometimes irreversible. The vitamin is essential for myelin production, the protective sheath surrounding every nerve fiber in your body. When B12 is low, myelin degrades. Initially, you feel tingling, then numbness, then coordination problems. In advanced cases, subacute combined degeneration of the spinal cord develops, a condition where nerve signals become permanently disrupted. The difference between someone with adequate B12 and someone deficient is not always obvious at first. But over time, two very different biological states emerge. Adequate B12 means normal red blood cell production, intact myelin sheaths, healthy homocysteine metabolism, which protects your heart and brain. Low B12 means megaloblastic anemia where red blood cells are large but dysfunctional, elevated homocysteine which damages blood vessels, and progressive nerve damage that mimics aging. The gap between these states widens every year. The 2013 New England Journal of Medicine review by Stabler is considered the definitive clinical summary of B12 deficiency. It documented that serum B12 levels between 150 and 300 pmol per liter, the range labs often call normal, can still be associated with neurological symptoms and elevated homocysteine. The review emphasized that methylmalonic acid and homocysteine are more sensitive markers than serum B12 alone. The link between B12 and homocysteine is one of the most important cardiovascular findings of the past 2 decades. When B12 is low, a toxic amino acid called homocysteine accumulates in the blood. Research shows that elevated homocysteine is an independent risk factor for heart disease, stroke, and dementia. One meta-analysis covering over 16,000 patients found that every 5 micromolar increase in homocysteine raised stroke risk by 59%. Certain populations face disproportionately high B12 deficiency risk. Research consistently shows that gastric absorption of B12 requires intrinsic factor produced by stomach cells. As we age, stomach acid production declines, meaning even people eating B12-rich foods may fail to absorb it adequately. Studies find that adults over 60 have a deficiency prevalence of 10 to 30%. People taking proton pump inhibitors for acid reflux have even higher rates. The neurological symptoms of B12 deficiency follow a predictable progression that researchers have documented carefully. Early stage, persistent fatigue, mild cognitive issues, occasional tingling in fingertips. Mid-stage, numbness in hands and feet, mood changes, difficulty concentrating that affects work performance. Advanced stage, balance problems, memory impairment that mimics early dementia, and in severe cases, spinal cord involvement. The critical point from research is that these symptoms are reversible in early stages but become permanent if deficiency persists for years. Understanding B12 deficiency requires understanding how absorption works. B12 from food must first be released by stomach acid, then bind to a protein called intrinsic factor produced by the stomach lining, then get absorbed in the last section of the small intestine. This is a 4-step process. Any disruption, low stomach acid, intrinsic factor problems, intestinal issues, or certain medications, breaks the chain. This is why eating enough B12 is not sufficient for some people. The body's B12 storage is a double-edged sword. Your liver can store 2 to 5 years' worth of B12, which is why deficiency develops slowly and is often undetected for years. This is both a protection and a trap. It means you can eat adequately for years, then stop absorbing B12 due to a medication or age-related stomach changes, and not experience symptoms for 2 or 3 years. Research points to clear actions for addressing B12 status. First, get your levels tested, and ask specifically for methylmalonic acid and homocysteine alongside serum B12, as these functional markers are more sensitive. Best dietary sources of B12 are clams, beef liver, sardines, salmon, beef, and eggs. For those with absorption issues, research shows that cyanocobalamin and methylcobalamin supplements are both effective, though methylcobalamin may have advantages for neurological support. Sublingual supplements bypass some absorption issues. The risk-based logic from research is straightforward. If you are over 60, then declining stomach acid means you likely need supplemental B12 regardless of your diet. If you take metformin or long-term antacids, then your absorption is pharmacologically impaired. Supplementation is clinically advised. If you follow a plant-based diet, then no food sources supply sufficient B12 without supplementation. If you experience chronic fatigue, tingling, or unexplained brain fog, then B12 testing should be one of your first steps. Vitamin B12 deficiency is common, underdiagnosed, and dangerous when left untreated. Research shows up to 40% of adults have suboptimal levels. The damage it causes to nerves, blood cells, and cardiovascular health progresses silently for years. The warning signs are real: fatigue, brain fog, tingling, numbness, mood changes. They are not just stress. They may be your nervous system trying to tell you something is missing. Get tested. Know your numbers. The intervention is simple. If any of today's warning signs resonated, the fatigue that doesn't go away, the tingling you've been ignoring, the brain fog you blame on stress, consider asking your doctor specifically about B12 testing. Not just serum B12, but methylmalonic acid. The research is clear. The intervention is accessible. And the difference between catching this early versus late is the difference between full recovery and permanent neurological change. Your nervous system is worth one blood test.